So based off your testing, we identified that you have a limitation extending backwards, and particularly through your hip. So I'm going to give you a couple exercises here going through the spectrum of releasing from a soft tissue standpoint, moving into a contract relax exercise to increase your passive motion, and then finally actually utilizing it through active kind of loaded movements as well too, so that increased range of motion sticks. So a couple areas that I want you to address first for soft tissue work. The psoas, so if this is your belly button, you're coming in from about a 45-degree angle, and we're going to push that ball kind of back towards the spine. We're going to work from the top of the hip bone to the bottom of the rib cage. The second area is going to be hip flexors and coming down through your quad. Once you get down to the quad, we want to make sure we're rolling inside, top, and the outside. The most important in terms of the muscles that cross up into the hip are going to be right down the middle there, in the rectus femoris. So those are going to be the couple areas that we're going to address right off the bat. So they're going to look like this. You're taking the ball kind of right in through here, coming down onto my stomach. A little bit of an angle, so maybe 30, 45 degrees up, so that ball has about a 45-degree angle up towards my spine. Going to find the spot that's uncomfortable. I can either just hang out there until it eases, breathing into it, or I can move kind of up to search higher and lower. Okay. After I've done that, I'm going to bring the ball down into my hip flexor. Which is basically the top of your quad on the inside of that hip bone. I'm going to roll out through there. I can actually try lifting my leg up and down on the ball, and then I'm going to work my way down onto my quad, finding spots that are uncomfortable, bending my knee up and down. Okay, so if you do this correctly, this probably takes you somewhere between 5 to 10 minutes if you're doing both sides and you're doing it well. You have a restriction here, so don't be surprised if these areas are uncomfortable. Okay. After you've done that, we're then going to move into a contract relax exercise to loosen up the hip flexor. So we're going to come into a half kneel position, engage through your core, tighten our glutes, driving forward, maintaining neutral. We're not dumping our pelvis forward and arching our back until we feel like we get a stretch through here. Once I get there, I'm going to open up, palm forward here and palm forward this side. I'm going to squeeze back, squeeze my shoulder blades, squeeze my butt, squeeze my leg as hard as I can, about 3 seconds. And when I relax, I should be able to sink into that stretch a little bit more. So you're trying to contract as hard as you can, pinching your back, your glutes, your quad on the leg that's down. About 3 seconds, relax, and then sink it further into the stretch. Do that 2 or 3 times, and once you get to that second or third position where you feel like you're further into the stretch, hang out there for about 30 seconds to a minute, and just get comfortable in that increased hip extension range of motion. And then after that, then we're going to move up into a walking lunge, which I'm going to show you next. So you've rolled out, you have actively tried to increase the passive motion by using that contract relax technique, and the last phase to increase our ability for your hip to extend is going to be actively using that. So a walking lunge is a very simple way to do that. What it looks like is basically stepping forward with one leg. I'm keeping this leg behind, so that's that extension. So that hip is extending back. So this would be neutral, where my thigh is directly underneath my hip. That would be extension. We want to try to work to get as much of this as we can without dumping our pelvis forward and arching our low back. So when I do a walking lunge, I'm going to step forward, get a little stretch, come down, maintaining neutral, leg is behind, and then coming back. I'm going to actively alternate legs, feeling a little bit of a stretch through here. Depending on how easy that feels, if you want to add a little rotational element, I can come here, rotate over my lead leg, and come back. So hopefully that helps you to understand those different passive, in terms of mobility, helping the tissue improve, and then that passive mobility in terms of the contract relax stretching, and then actively loading that. So these are critical if we found that you had a decrease in your ability to extend backwards. If you have low back pain, if you sit a lot, these exercises are going to be absolutely crucial for you to reach your goals.